Good afternoon. Welcome everyone to our program Lifestyle with Dr. Mobi. I'm Dr. Mobi. Today we have great guest, Dr. Tayyib Rana, and I will introduce you in few minutes. But it's very important that today we want to make sure audience knows a little bit or learn a little bit about diabetes and hypertension and then effect from lifestyle. I thought I picked these two because these are right now one of the most important in actual right now with COVID-19. They have seen a lot of patients whose prognosis depends on if they have these underlying conditions, especially obesity, diabetes, hypertension, and it can really impact the prognosis. And it's also very important for me, which I have seen in a lot of patients, especially from Asian background myself and Spanish and non-whites. There's a very high incidence of these, and it is leading to one of those biggest causes in mortality, morbidity. And so we want to make sure people understand that these are the major killers and silent killers. So it's very important that we focus on that. To give example, right now, 10.5% of US population by one estimate has diabetes and 10.2 is diagnosed. So this 0.3% still undiagnosed. For hypertension, it's about 29%. And so those are very high figures. So with these in mind, we welcome our guest, Dr. Rana. Thank you for taking time. Tell us about yourself.
Dr. Mubashir, thank you for having me on. I appreciate it. My name is Dr. Tayyib Rana. I practice in the state of Virginia, in the DC, Maryland, Virginia area. I was born and raised here in the United States, son of Pakistani parents, actually son of a Pakistani physician who was an internist and nephrologist. My training is first in internal medicine, and then I went on to do ophthalmology. So I have kind of a primary care as well as ophthalmic background, which is very nice in serving the patients.
Okay, thank you. Thank you. So tell us a little bit about what's your experience, especially in reference to our population, that people are not educated or they are not taking care of their health in terms of your diabetes, hypertension, and obesity.
You know, it's interesting. On the one hand, from an ophthalmic standpoint, when we look at diabetic patients in a clinical setting, the incidence of diabetic retinopathy from diabetes has decreased tremendously over the years. And I think that's been due to greater dissemination of information on how to manage diabetes and just better management tools following the A1C level, for example. Even a significant number of patients now know what that means, whereas a decade ago, that wasn't really familiar. However, in our community in general, there still tends to be lack of knowledge and lack of education in the particular incidence and the presentation of diabetic disease. For example, a lot of our patients don't know what an A1C level is. And they often don't even know the medicines that they're on, the mechanism of action. They just say that, doctor gave me this medicine and I take it, and I don't really follow my sugars unless I go back into the office. So even though diabetes is always on the rise, but the incidence of diabetic retinopathy is less than it used to be a decade ago. In our particular population, we still see it. And I think it's because of the lack of education, and therefore translates into the lack of tight control.
Okay, yeah. And so one of the other important thing is, which I'm focusing and making sure with my program and also elsewhere, is education. So a lot of data actually is about hypertension and other disease. It's mostly based on research on whites and some on other population. So especially Asians, we have a little different in terms of numbers, which are really not studied. So for example, the BMI, the numbers which they have for 25 for obesity, actually I have seen that for us, actually the pre-diabetes and all those numbers are way earlier than they were. So we manifest these disease much earlier than population whites would show, and organ damage. So one of things which we, as you know, we're doing primary care also, and we see is that we look for if you have kidney problems, if you have problem with eyes, and if you have problem with heart. So one of the important thing is about eyes. People don't know that you can really tell a lot about somebody's blood vessels and the condition they have by just looking at the eyes. I get many times a referral from eye doctor. He has already changes in his eyes about um, blood pressure being high, and his blood pressure might be a little bit high when this. So tell us a little bit about that asymptomatic patients, which you see sometimes with eye symptoms.
Yeah, that's a great point, Dr. Mubashir, that we, as ophthalmologists, we have the privilege of directly viewing some of the smallest blood vessels in the human system. Mm-hmm. And we know that diabetes is a microvascular disease. So many times patients will come in that appear to be adequately treated, and we look at the eye exam and we see changes in the eye. Mm-hmm. What are those changes? These are changes in the blood vessels that actually nourish and line the retina and supply blood to the eye itself. Mm-hmm. So as we know, there are arteries and veins that come into the eye that supply blood and nutrients through the blood and then take it out through the veins. We will see changes in blood vessel walls. For example, some of the early changes that we will see is weakness in the arterial walls or the arteries that supply the blood. Those areas of weakness look like little pouches coming off the blood vessels, which we call microaneurysms. Mm-hmm. And other times we will see actual spots of bleeding in the back of the eye, in the retina, which we call dot hemorrhages, or sometimes bigger hemorrhages or bleeding called blot hemorrhages. So these are early signs of diabetes, and depending on how great the manifestation of these signs are, we then have classification systems on how severe the disease is. But sometimes if we see these changes, this can often be the point at which we relay to the primary care physician, the numbers may be coming out okay in the clinical primary office, but maybe we want to tighten up the control because we're seeing these changes in the microvasculature. The same thing applies to hypertension. We will see changes at the point where arteries cross veins, and we can see what we call arterial venous crossing changes, which can lead to compressive vascular occlusions and hypertensive retinopathy, as it's called. So again, if we see these kind of changes happening early, we can notify the primary care physician who can get more aggressive in the therapy.
Okay, thank you for sharing that. And also, if you can educate us a little bit about most common problems with eye, generally do you see in your practice, with eye problem, which anyone should pay attention to?
Well, some of the most common problems that we see, interestingly enough, depending on the age group, are not necessarily related to diabetes or hypertension. The most common problems that we frequently encounter are amongst healthy people, which are that younger people tend to get refractive errors such as myopia, which is the most common. Actually, myopia is an epidemic in society at this point, which is called nearsightedness. So that's one of the most common problems that we see in the younger age group. And then as we approach middle age, people start feeling like they're losing their vision because they sit on a computer or they're looking at their phones and they just can't seem to focus in. And they really think they're actually going blind. However, this problem is a very common problem, which is called presbyopia, which is the normal aging of the eye in which the human lens cannot alter its shape and thus its ability to focus. And so this affects anything from about arm's length in towards the body. So mid-range and close-up vision gets affected, for which we then correct it with various treatment mechanisms. I mean, it's anything from reading glasses to now there's incredible surgical procedures. So these are some of the most common complaints that come in. But when you get into more serious issues, especially as we have an aging population that's living longer, particularly in Western countries, people start losing vision, and they're really, truly losing vision to organ-threatening illnesses like macular degeneration and glaucoma. Now, macular degeneration will manifest itself as the inability to see things clearly despite having the best pair of glasses or contact lenses, and that's because there's actual damage going on in the neurological structures in the eye that process vision. The same thing happens in glaucoma, although in glaucoma you don't get symptoms until the disease is very advanced. But these are serious illnesses that as people are living longer, we're seeing more in society, and glaucoma actually is very prevalent among the Southeast Asians.
Okay, well, thank you. And for audience, just for educational purpose, glaucoma is where there's increased pressure in the eye, and you should actually go to doctor. So if you have pain, you have changes in vision, headaches also can happen. So make sure see eye doctor and get it measured. So it's very, very important that pay attention, don't ignore it. Like doctor said, many times there could be that you're not seeing things despite glasses, and you think, oh, maybe I forgot or getting old. No, it's not. Probably you need to pay attention to your eyes. And unfortunately, if you don't take care earlier, you can really lose vision and you can be blind. So one of the leading causes of blindness actually are some of these diseases. So pay attention. So anything also you would like to give on cataract or some
yes.
problem with?
I didn't include cataract in what I just said because I wanted to speak about more serious medical issues. But cataract is the leading cause of blindness in the world, and that is a natural change that happens in the human lens as we age. It's also an aging process, but the human lens starts to become discolored or cloudy as we age. And what this does is two things. In the beginning, it's not the inability to see things down the street. It's actually you start feeling like that your night vision is not as good as it used to be. When you're driving a car in the rain, it doesn't feel as comfortable. If you're on an unfamiliar road, you don't feel as comfortable as you used to be driving a car. These are typical symptoms which is called decrease of contrast sensitivity at night. So then as the cataract progresses, you start not being able to see across the room as clear. The television doesn't look as clear. The ticker going across the bottom of the screen doesn't look as clear. So this is called cataract. And cataract in Pakistan, for example, we call cataract safad motia. So this is a clouding of the lens. Very, very treatable state of affairs. It's one of the most ancient surgeries that we have in medicine, but today it's a very, very advanced procedure that is done in incredibly nice ways.
Okay, well, thank you for. And also, do you see with the use of any phones and iPads or any those devices in kids, are the eye problems more now?
Yeah, that's another great point, Dr. Mubashir. So what happens, as I said, we have an epidemic of myopia or nearsightedness. Now, when I say nearsightedness, it confuses the common person because nearsightedness, you tend to think that it means that you can see up close but not far away. Well, the fact is you can see far away, but you need glasses or contact lenses or some other treatment to be able to see because the light doesn't focus where it's supposed to on the retina for far away vision. For close-up vision, it's okay. Now, why are we seeing this great advance in the population that needs glasses at very young age in children? You often see on TV, you'll see pictures, for example, especially during holiday seasons, of these poor children in Africa, for example, who are living in villages, and you don't see any of them wearing glasses the way you see in more developed countries. And the first thought that comes to people's mind is, well, maybe it's because they can't afford glasses, maybe they can't get eye exams, but actually studies have been done now which show that that's not the case. These kids actually have excellent vision. And so research is going into this, and the current prevailing theory is that Western or more developed countries and societies children are spending more time indoors. They're not getting the sunlight between the ages of infancy and, let's say, 5 to 6 years of age. They're on video games, they're on tablets, they're on TVs. And in general, kids don't go out in their neighborhoods and play the way they used to when we were kids. And so the prevailing theory right now in myopia or nearsightedness is that we're not getting something about sunlight exposure, and being outdoors at a young age is critical to good visual health. And if you don't get that, your chances of having nearsightedness and going into glasses at a very young age goes quite high, even if there was no family history.
Okay, well, I did myself didn't know that. So thank you for sharing all that. Also, if with the current COVID-19 going on, what are you seeing any more signs with eye problems or any more signs of that?
So initially, when COVID presented itself, for example, in the United States, and actually, let's go back before that in China, we all know the story of the ophthalmologist who first reported these cases and was not listened to by the Chinese government. But eventually, the government did listen, and they did admit the fact that this was a very, very terrible novel virus. But what the ophthalmologist was not seeing was eye symptoms. Because ophthalmologists tend to come so close in their encounters with their patients, he was noticing increasing respiratory issues in these patients. So never